We're swimming in more health data than we've ever had before. So why does it feel like our doctors are drowning in paperwork? Well, today, we're going to dig into how new AI tools are helping us finally cut through all that noise and go from just having tons of information to actually getting some real insight.
Here's what we're going to cover. First, we'll unpack what this information overload really looks like. Then, we'll see why the first wave of digital solutions didn't quite hit the mark. After that, we'll dive into how the new generation of AI is starting to truly understand data, which brings us to the privacy dilemma. It's a big one. And finally, we'll look at what a smarter, safer future for healthcare could look like. Let's get into it.
So let's kick things off with this question, because it really flips the whole script. We usually think about healthcare challenges in terms of diseases, right? But what if the biggest thing standing in the way of better care isn't a virus, but just the sheer, overwhelming mountain of data, paperwork, and admin tasks?
And believe me, this isn't just a theory. A few years back, a study found that Croatia's healthcare system was only about 57% efficient, one of the lowest in the entire EU. And it wasn't for a lack of spending. The problem was a massive administrative drag that just soaked up resources without improving anyone's health. It's a global thing, really. Pouring more money in doesn't automatically mean better health.
All right, so let's get to the root of this overload. And you might be surprised to hear it doesn't start in some high-tech hospital database. Nope, it starts right in our own communities.
Just take a look at this recent report from Southwest Michigan. When community agencies actually asked people what they needed, yeah, medical help was on the list. But it was only part of the story. Things like housing, food, and just getting around were often way more urgent. For a health worker on the ground, a person's life isn't just a diagnosis. It's this whole complicated web of social factors. And trying to track all of that, it's a massive data nightmare.
So the first real attempt to fix this was, of course, to digitize everything. But as we're about to see, just turning a paper problem into a digital problem, well, that came with its own set of headaches.
Electronic medical records, or EMRs, felt like a huge leap forward. But here's the catch. They were mostly designed by hospitals for billing. So think of it like this. They gave you a perfect list of ingredients, but absolutely no recipe. They were fantastic at telling you what the clinical problem was, but they totally missed the why, the social stuff, like unstable housing or no transportation, that was often the real root of the issue.
And this chart just lays out the difference perfectly. On the left, you've got the old school EMRs, all clinical, all the time. But on the right, you see systems like the COPE database from Kansas. The key thing here is it was designed by community health workers for community health workers to track the stuff that actually matters in someone's life. Are they employed? Is their housing stable? What are their goals?
And the scale of this is just wow. In a single project, that one database tracked over 55,000 client encounters. Let that sink in. That's 55,000 conversations, moments of support, and connections to resources that are completely invisible to a normal medical record. It just goes to show how much care happens outside the four walls of a clinic.
So what this all adds up to is a single, unified view of what's happening in the community. These purpose-built platforms track a person's entire journey and manage this huge network of over 2,500 different organizations all in one place. It takes what was a chaotic, fragmented mess and turns it into a truly coordinated effort.
Okay, but now we're seeing the next leap forward. It's not just about collecting and organizing data anymore. Now it's about using artificial intelligence to actually understand it.
The biggest hurdle for AI in a field like healthcare is always going to be trust. How do you know the AI isn't just making stuff up? This comment from a Reddit user about Google's NotebookLM absolutely nails the solution. It's a feature called grounding. The AI gives you direct citations for everything it says, linking every single point back to the original source document. This is huge because it lets a doctor or a nurse check its work, and that is absolutely critical for building trust.
And check this out. This is where it gets kind of mind-blowing. Someone on YouTube actually showed this workflow for doctors. Imagine taking a bunch of super dense, complex medical research papers, uploading them to an AI, and just asking it, hey, can you create a simple, easy-to-understand podcast script explaining this to a patient? This isn't just about summarizing anymore, it's about translation. It's taking information that used to be locked away and turning it into something that can actually empower a patient on their own health journey.
And that right there, that's the real game changer. We're moving away from these old digital filing cabinets, which were just systems of record, to tools that are active partners in thinking. These new systems of understanding don't just store data. They can synthesize it, they can create with it, and they can explain it.
But of course, with all this incredible new power comes a huge, huge question. How do we use these amazing tools while protecting some of the most sensitive data we have?
This really brings us to the core tension in all of this. On one side, you've got these super powerful cloud AI tools like NotebookLM. They're amazing for crunching public research, but to work, they have to send your data to some external server. On the other side, you've got local AI models that you can run right on your own computer. This gives you maximum privacy for sure, but they're often not as powerful or easy to use. That's the choice that every healthcare organization is wrestling with right now.
So to really put this trade-off to the test, researchers created a fake or synthetic patient case for someone they called Jane Doe. Her file has it all: super sensitive clinical details about her cancer diagnosis and treatment plan, plus all the administrative stuff like insurance info and appointment logistics. They then fed this exact same file to both a cloud AI and a local AI to see how they'd stack up.
And here you can see the results. That orange bar is the cloud tool, NotebookLM. If you look all the way to the right under Key Information Coverage, it scored way higher. That means it was much better at pulling out the most important facts. But remember, that performance came at the cost of sending sensitive data off-site. The local model, it wasn't quite as accurate, but it kept Jane's data completely private. That's the dilemma in a single chart: performance versus privacy.
So where do we go from here? How do we get the best of both worlds? How do we harness all the power of AI, but also get the security that our most private data absolutely deserves?
Well, the path forward really has to be built on a set of core principles that are just non-negotiable. Things like making sure patients give informed consent for how their data is used, demanding transparency so these algorithms aren't just mysterious black boxes, guaranteeing that a human being is always in the loop for big clinical decisions, actively fighting bias in the data, and above all else, making patient privacy and security the absolute #1 priority.
And really, this is what it all boils down to. The future isn't about choosing cloud AI or local AI. It's not a binary choice. It's about building a smart ecosystem where we use the right tool for the right job. Powerful cloud tools for public research and super secure local AI for sensitive patient records. The goal is a system that's both intelligent and trustworthy.
So I guess I'll just leave you with this thought. New technology can sometimes feel like it just happens to us, but it's always built by people making choices. As AI becomes more and more a part of our health, maybe the most important question we can ask is about the values of the people writing the code. Who are they? What do they believe in? And who holds them accountable? Because the answer to that question, well, that's what's really going to shape the future of our health.